Good evening. My name is Josh Goodwin. I'm the physician at Regenexx Las Vegas. Tonight, we're just going to give a webinar. Really, this is one of our basic overview webinars for Regenexx Las Vegas. So let's see, somebody was talking. Oh, chat was disabled. Okay. The Q&A section seems to be working okay. So thank you for that. We'll look into that. But this is more just a general overview of what we do in this clinic, kind of how we make decisions, just really providing a brief overview of a different approach to treating orthopedic conditions. So if any of you have been to the clinic or know about what we do, this might be very familiar and not be a lot of new information. We haven't done a webinar in a little bit, so we're just getting back, starting with more of the basics. There will be some time at the end for me to go over specific questions that you guys have. So if through the webinar you guys have questions that come to mind, you can just chat them down in the question and excuse me, question and answer section. And then I'll spend time at the end just making sure I cover any question that gets raised at that time. I probably won't stop during the middle of the webinar to answer the questions, but there will be some time at the end if you stick around through the whole presentation. So just a little bit of my background. I grew up in New Mexico. I did my medical school training there. I'm a medical doctor. I did residency training in San Antonio. It was a field called physical medicine and rehabilitation. That's more of a non-surgical field, focusing on functional restoration, non-surgical orthopedic care. I did do fellowship training in Arizona in sports medicine and interventional spine. I also had some exposure and participated in conducting research on utilizing bone marrow-derived stem cells for low back pain and disc degeneration. So that was a little bit of my initial exposure back in 2014. I am board certified in physical medicine and rehabilitation. I've been with Regenexx for 8 years, coming up on 9 years. And I'm a co-author on some review articles for stem cells for low back pain. And so that's a little bit about my background. I've been at the Las Vegas clinic since 2018. So as I mentioned, this is really just a brief overview of the Regenexx-based treatment options for orthopedic conditions. So everything we're going to discuss is more orthopedic-based, which just means muscle, tendon, bone, joint type conditions. These conditions affect people of all ages, whether it be traumatic through injury or through wear and tear and degeneration or overuse type injuries. And these affect all age groups, as you can see on the screen. And it actually costs a lot of money to be able to care for these different conditions, back pain, knee pain, surgeries, injections, all these things cost a lot of money. And everybody knows somebody that has some type of orthopedic problem, whether that be a shoulder issue, a back issue, a knee issue, a hip issue. And again, that may be related to degeneration, overuse, or traumatic type injuries. And a lot of us are probably aware of the current and traditional based options for orthopedic conditions. Most of us have used over-the-counter pain relievers like ibuprofen and Aleve. These are just anti-inflammatories. Some people have needed to use muscle relaxants or opiate pain medications like morphine or hydrocodone. Some of us have had steroid injections, so the corticosteroid injections, not the testosterone type injections, but the corticosteroids, which are strong anti-inflammatories. Many of us have needed to use bracing or physical therapy, or even knee replacements or other type of surgical intervention. And these can help, and when used sparingly can be beneficial, but a lot of times these different options either carry certain risks that have side effects, or create other problems. So even something as simple as taking ibuprofen to leave or other non-steroidal anti-inflammatories, they all are associated with increased risk of heart attacks, stomach ulcers, strokes, high blood pressure, allergic reactions. There are people that die every year from the use of these medications. And so these are one of the most commonly prescribed medications for orthopedic problems. And we're learning that they, have more and more side effects that we need to be aware of, like reduction in healing, maybe exacerbation of pain over a long period of time. So things to think about in trying to pursue different options for orthopedic conditions. Many of us know about cortisone or these steroid type injections. Again, these are just strong anti-inflammatories, and they can help with pain and inflammation, but some of the benefit comes typically with some long-term detriment, potentially, especially with repeat dosing. And so some of the complications from steroid injections are increased blood sugars, specifically if you're diabetic, weight gain, flushing, anxiety. They are directly toxic to cartilage, and so they can accelerate osteoarthritis progression. They're associated with subchondral fractures, osteonecrosis, which is bone death, and rapid destruction of the joint. And so these are things that we see over time. And there's multiple studies looking at that, discussing how joint steroid injections, probably not that safe, related to some of the adverse effects that can happen with repeat dosing, and that joint steroid injections increase the risk of knee replacement. So it actually accelerates your need for a knee replacement. So people that are trying to preserve their tissue, it's not the best option for you. And then we have kind of surgical options, of course, knee replacements or spine surgeries or rotator cuff repairs, all of which can be very beneficial, but they also come with a exposure to more significant risk. So knee replacements can have up to a 16% complication rate. This is a serious adverse complication rate. Knee arthroscopy, 5%. If we look specifically just at knee replacements, only about 40% of people get back to full activity. And it's pretty common for people after different surgeries to continue with pain. So one of the common complaints after knee replacements is continued pain. And so those are things we need to think about. The same can be said with lumbar fusions, spinal fusions, and other joint replacements. We did conduct, and we'll talk more about Regenexx and the history of it, but our organization had conducted a 10-year study on 2,300 patients looking at adverse effects from some of the injection procedures that we provide, which we'll talk more about. And if you look at the serious, the adverse event rate was 0.17, and most of the things were like pain, inflammation, that kind of stuff, versus what you're exposed to with more traditional surgical intervention. And that's not to be, some of these things are needed, but sometimes they can be prevented if addressed early on in the degenerative process. And so, as I was mentioning, Regenexx has been around since 2005, started in Colorado. Now there's getting close to about 70 clinics around the US and some international clinics. So we have some in Australia, Belgium, Cayman Islands, India, China, United Kingdom. And so we're just one clinic of kind of a larger organization. And since 2005, when it was founded and kind of grown, everything's really been this innovation and research and outcome tracking process, so that we're aware of what we do and how much it helps patients or doesn't help patients, or what the complication rates are. So this is really unique in the fact that we don't just do treatments and not really know what we're doing. We're constantly innovating. We have a big research and development center in Colorado. We publish clinical research. We have a large registry. We're tracking probably 50 or 60,000 patients right now in total. And we use this information to help educate patients and publish and educate the medical field. And so we feel that that's important. That's unique compared to maybe other clinics that may provide similar types of treatments. And again, we think a lot of what we do is creating a new specialty, and we call that interventional orthopedics. This is really just the natural evolution of medicine. So we're always trying to find new ways to improve outcome, reduce risk, reduce invasiveness. And so being able to understand certain things on how our bodies heal, what types of cells can we extract and use to facilitate a healing process when it's not happening naturally. And so basically, we're just using needle-based procedures, isolating different types of healing factors and components, and with a goal to preserve tissue, reduce downtime, and reduce exposure to risk of more invasive surgery, like we saw on some of the last slides. And so basically, this is some of the things we use are called orthobiologics. And so to set the foundation of why these things can be beneficial and how we can use them to help reduce the need for medications and hopefully help prevent surgery, we have to understand that, and we're all aware of it, whether or not we recognize it, but our bodies have an ability to heal themselves to a degree, right? You have to have proper blood flow and cellular access, but we break a bone and it heals. We cut ourselves, we get new skin. Surgery oftentimes helps stabilize things, but then your body still has to heal from even surgery. So our bodies have a unique capacity to respond and deal with tissue injury. And there are different components and different types of cells and factors and signaling that takes place to produce a healing response. And so some of these factors are found within your blood, like your platelets. Platelets are unique in the sense that they help activate healing, and we'll look a little bit more at those growth factors that help stimulate that. We have stem cells found throughout our body. Specifically, the mesenchymal stem cells can be found in bone marrow, fat, and your joint tissue around blood vessels. And these are always there responding to injury and helping maintain tissue. And then we have proteins in our body that help maintain a balance for healing to take place. And so our bodies are trying to maintain a homeostasis. And so the platelets found in our blood contain different growth factors that are signals for different aspects of healing. Some growth factors stimulate cell growth. Some of them help create new blood vessels to grow into an area of injury. Some of them help recruit cells to the area and help promote, collagen production. And so we can use the properties of platelets and isolate them, concentrate them, and precisely deliver them into areas of degeneration. So tissue that's maybe getting overloaded and the body can't keep up with the wear and tear, or areas where you have reduced blood flow, like cartilage or degenerative tendons that then eventually tear. And so we use platelets typically for mild to moderate arthritis, tendonitis, bursitis, so inflammatory type conditions and small tears, muscle injuries. We use it in the spine. a lot of it depends on the type of tissue, the severity of what's going on, but this can be very beneficial depending on the type of orthopedic problem. As I mentioned, there's different proteins that help keep inflammation in check in joints, and one of them is called A2M. And these can be isolated from the blood and concentrated and injected to help treat and reduce cartilage breakdown and joint swelling. And that can be beneficial for making joints feel better and set them up for being able to heal themselves. We also contain or have a type of stem cell called mesenchymal stem cells throughout our body. The area that we tend to isolate them from is the bone marrow. These cells respond to the injured environment. They help direct and organize tissue repair, and then they can help maintain a balance of healing inside a joint or around injured tissue. So they're very important for the cascade of healing and help to promote new tissue growth. When you check these cells in the lab, they can actually transform into different types of tissue. So they can turn into a different type of tissue to be able to help fill in gaps. And so we tend to use these types of cellular injections for more moderate to severe conditions, tissues that have tears to a certain degree. Now, there will be times when the tissue damage is just too great, and then those times is when we recommend surgery and the more traditional treatment options. So there is a limit and kind of a limitation of what these different types of things can do, but there's also a lot of patients that can benefit from these types of procedures and treatment options. And so this is just to highlight that over the years, there's been tremendous growth in the amount of research done looking at stem cell therapy for orthopedic problems. So each one of these little circles and triangles and squares are individual studies looking at stem cells for orthopedic use. This is specifically for bone marrow stem cell orthopedic use. So if people say there's not enough data, there's no research, they just haven't looked closely enough. This is specifically looking at platelet research and comparing it to the more traditional treatment options. So for example, for knee arthritis, PRP has been compared to gel injections, exercise, medications, multiple injections, saline, steroids, with PRP being as effective or more effective than the more traditional treatment options. And you can see for different parts of the bodies as well. This is specifically for knees, comparing the different studies. So that's just really to highlight that there's data that we're obviously tracking in patients. There's people outside Regenexx that publish data. And so there is, growing data sets to show benefits. And there's certain conditions that respond better. Not everybody's a good candidate. And so we have to be able to have a process by which we can assess patients to determine, would you be a candidate for some of the things that we do and these types of treatment options for orthopedic conditions. And so I want to take the next few minutes just talking about our process and how we go through deciding if one would benefit from these different options, because these are medical procedures. And so not everybody's going to be a good candidate. Everybody's condition is different. Their other medical conditions are different. Their risks are different. Their ages are different. All these things can play a role. And so we kind of have the 3 Ps for success. So we have a prediction process. We have our processing, which we feel sets us apart. And then we have the precision of actually delivering these cells to the right area. And as I mentioned, everything we do is orthopedic based, from the spine, shoulder, elbow. So arthritis, tendonitis, tendon tears, degenerative discs, disc herniations, pinched nerves, knee arthritis, meniscal tears, foot arthritis or plantar fasciitis, tendonitis. So all these things are things that we have treated in the past. And so part of the prediction process is actually a evaluation. As I mentioned, we have our registry and the research. All of this information helps us in our evaluation process to better understand and how to educate patients. And so our consultations are about an hour long. We like to review the imaging. We discuss that with you. We perform physical exam. And then we talk about all of the options that could potentially help, not just the things that we do. But this is where we customize the treatment plan based on what we find and what we see on image and what we see on exam. And that's really the only way to understand if these procedures would be of benefit for you. And as I mentioned, we have our big our registry. This numbers are a little bit old. I think our knee outcomes and the patients we're tracking is close to 15,000 now, but we track patients to see who's getting better, how much improvement are they getting amongst all the different locations of the body. And so these are all on the regenexx.com website, but we use this information as part of our decision-making process. We use our published research and the clinical studies that we perform to, again, better help us understand what we can treat and what we can't treat. And that whole evaluation process helps us determine who's a candidate and are they a high, moderate, or low responder. And this is determined, again, by imaging, exam findings, and every part of the body is a little bit different and unique in its own characteristics. And so not everybody's going to come in and be a good candidate. Some people will come in these other groups, and we have to be able to educate you on where you fit and what that means regarding outcome. Now, say we did think you're a candidate and we all decide to move forward with, the expectations of the discussion of what we would expect for outcome. We have to be able to isolate the cells that we want to use for the injection, right? Platelets, growth factors, stem cells, these kind of things. And so it's important that you have a flexible lab because dose matters and not everybody's the same. So not everybody should get the same treatment. So because we have a manual lab, we can customize the types of cells, the types of platelets, the platelet concentration, the dosing, all of those things can be customized based on age, severity, location, tissue, and we hold many patents on processing and isolating techniques. So this is important when people are trying to choose between, say, our clinic and the orthopedic doc's office that maybe dabbles in it here and there, right? There's going to be a huge difference in their expertise on these types of treatments versus what we do. Now, once we get the right cells, the right concentration, we understand the problem, then we have to be able to deliver those cells precisely to the problem. So, for example, if you have behind the kneecap arthritis and a bone injury, you have to be able to get these cells directly to that area. So people have to be able to use image guidance like X-ray or ultrasound. Again, this is a shoulder injection utilizing ultrasound. Utilizing X-ray. This is a treatment for carpal tunnel, utilizing an ultrasound and a small gauge needle and injecting platelet growth factors around the nerve. You can't do this if you don't know how to use image guidance. You're not going to be safe. You're not going to get it where it needs to go. And so these 3 steps are what help set Regenexx apart amongst many other clinicians that maybe say they perform similar types of treatments. Now, as an example, for people that might need a platelet procedure, we call it SCP, super concentrated platelets. These are those patients with mild to moderate arthritis, mild to moderate tendinitis or small partial tears, some disc issues in the back, irritated nerves. These are just one-day procedures where there's a blood draw, processing, and re-injection. Some people will always need more than one injection. Some people need one. The majority of people only need one treatment if you're in that mild to moderate range. And if it's more degenerative, it might last a few years. If it's more of a tear and you can actually get some healing, then that can last for a long period of time unless you re-injure it. So basically, after we perform these treatments, we have a follow-up process. Every 6 weeks, we like to follow up to make sure people are getting better. Some people will need physical therapy. Some people need some reduction of activity and bracing. But it's kind of beyond the scope to be able to describe every condition and every set of potential limitations, because it just depends on what we're treating and the severity of it, because there's going to be some customization based on your specific problem. Now, the stem cell process from bone marrow for arthritic joints is a little more involved, where there's 3 steps, where we perform a pre-injection with prolotherapy, which is like a pro-inflammatory healing initiator. Then we perform the bone marrow and the bone marrow derived cell injection. And then we follow that with a PRP, a platelet growth factor injection after that. And so that's kind of our 3-step process for joints. So more involved. Again, people will likely need some therapy or bracing. Everybody will have follow-up. We'll continue to track the outcomes. How are you doing? Are you getting better? And so that's kind of a more involved process for more severe or more moderate to severe conditions. Again, not everybody needs this. I would say probably 15 to 20% of our patients, we recommend this. The majority of people might fall within the platelet realm. Obviously, there's a percentage of people that are not candidates for the procedure for one reason or another, or we recommend surgery, and then we help get them referrals. So those are the 2 main things that we see. Now, we do see a lot of stem cell hype out there. We understand that these procedures can be very beneficial for a large majority of patients, but they're not everybody's a good candidate, like I mentioned. And so people need to understand that there are limitations, and that sometimes these are not going to help regenerate tissue if you have no tissue to help regenerate. And so that's why the evaluation is very important. We also have to understand that the FDA regulates cellular therapies to some degree. And if you're compliant and you stay within a certain realm of manipulation and type of tissues you're using, then it's considered the practice of medicine. If you're starting to use umbilical cord stem cells or things called exosomes that need to be cultured in the lab, or you're trying to grow out stem cells over weeks, and that's considered non-compliant with FDA. And they have many warning letters. They've shut big clinics down. They shut US Stem Cell down. They shut one in California, which those are going through proceedings. Many physicians have had their license taken away for performing things that are non-compliant or conditions that have not been researched. So we have to be very cautious about some of the claims being made with umbilical cord, placental-derived products, all of which have been found, at least in the United States, to be dead tissue. There's no live functional stem cells in placental or amniotic products. There's multiple studies showing that from UC Irvine, Colorado State University, Cornell University. So it's really not up for debate anymore. We've also checked multiple umbilical cord products in the United States showing 0 stem cells that are able to grow in culture versus taking your own bone marrow and can get stem cells to perform and grow all the time. So we don't really use umbilical cord products at this time, mainly because of a lot of the FDA regulations, mainly because some of the limited number of human-based studies, and the fact that they're non-compliant with FDA and you can get shut down. So Everything we use is what we call autologous, which comes from your own body. And we isolate them and can use them. We've looked at conditions for people that range from their 30s to their 90s. Some joints do have a reduction in outcome. For example, the hip joint can see a reduction with age. Knee conditions do not see a reduction with age. Shoulder conditions do not see a reduction with age. Spine conditions might decrease outcome in like once you're 85 or older. So it doesn't seem to play a huge role. We bring up this laser because we did add this to our clinic as an option to help reduce pain and inflammation. It can help quite a bit for more soft tissue injuries, more like recent ankle sprains, muscle strains, inflammation pre or post procedure. These things can be beneficial. It is FDA cleared and can be used for quite a bit of issues, which we have used a lot in conjunction with our procedures. And so having said all that, a lot of stuff to get through. Really, like I said, it was just a really brief overview to just introduce the idea that there are different types of procedural options for orthopedic conditions outside cortisone, outside medications and pain meds, and outside surgery that has a growing data set. We've been around for almost 20 years as an organization. We're tracking 50 to 60,000 patients in our registry. We publish research every single year on the outcomes. We perform randomized controlled trials on the different treatment options. And then there's people around the world that are also contributing to the data set. So it's just about understanding what the condition is, the severity, and what does the data show for your specific condition on how it can be beneficial. So I do want to see if there's any questions. There is a question. There are treatment centers that I'm just going to read the question here, or the statement, that say bone marrow therapy is not as effective as umbilical cord stem cells. They say umbilical cord stem cells are young and more viable versus bone marrow are older and not as effective. The different therapies are confusing for some people who are trying to make the best decision. So yes, I would agree that it does get very confusing. Now, to answer that, we have to realize that in order to say that one therapy is better than the other, you have to have some sort of comparative data that has been looked at to be able to answer that question definitively. There are 0 studies out there comparing bone marrow therapy versus umbilical cord therapy in any human trial. So we have to understand that. So there is no way to say that one is better than the other. We can't say that. There are more studies looking at bone marrow derived cells for orthopedic conditions than there are umbilical cord studies. There is some growing studies with umbilical cord tissue, which is going to be beneficial once we get more data. And so people that say that are basically taking a theoretical stance because umbilical cord cells come from younger tissue, and therefore they say since it's younger, it's going to provide more benefit. But there's no study comparing and actually proving that in any type of human or even animal study. Now to look at umbilical cord tissue, as I mentioned, the umbilical cord cells available in the United States are regulated and are unable to be able to purify or expand that tissue. These manufacturers are regulated by the FDA to not be allowed to expand the cells. And as I mentioned, there is a study that was just published by Colorado State University Stem Cell Center that looked at maybe 8 different umbilical cord products available in the United States, and all of them did not have any live functional stem cells. They were all dead tissue. They did contain many growth factors. And if you want to look at that study, I can send it to you. We've looked at different umbilical cord products to see if we could replicate what the reps tell us. Now, having said that, there are clinics outside of the United States that are not regulated by the FDA. And so those clinics are able to purify and what we call culture stem cells from the umbilical cord tissue, which allows them to grow and grow and grow to higher numbers. And then you're isolating purified, grown out cells over weeks. Then you take that grown out process right away, and you can either freeze them or you can use them. And that process is very different than what's available in the United States, because that process is not allowed by FDA. So outside the United States, people will hear of clinics in Panama and Colombia and the Grand Caymans or places in Europe, those kind of things. The products there and what's found in the US are not the same. And again, there's very limited data on umbilical cord products. The other thing about the practitioners that discuss umbilical cord products as being more beneficial, they fail to discuss the potential risks, right? As I was showing over here, there was a time where umbilical cord products got contaminated with E. coli from this specific company, Livion, and many people got infected with contaminated umbilical cord tissue, and people were hospitalized, became septic. And so you have to remember that these cells are being taken from somebody else in the labor and delivery ward. You hope that these manufacturers are assessing the tissue and the donor for communicable disease like HIV, hepatitis, and other types of diseases that can be transmitted on. A lot of the warning letters from FDA to these umbilical cord manufacturers have stated that a lot of these companies are not doing their due diligence and checking donors for communicable disease. So that's very important. The other thing is that this tissue is not your tissue. So the chance for rejection is there. Even in studies where they've looked at umbilical cord tissue, for example, leukemia, where patients need to get, say, umbilical cord tissue for a transplant because of cancer or whatever, there is a rejection rate. And these people are on chemotherapy. So the thought that you're not going to reject umbilical cord tissue because it's young or this or that is false, specifically with the products in the United States, because they're not purified stem cells. And so they have components of other tissue and other cells that your body might recognize as foreign and will attack the tissue, and at the very least kill the cells so they're not functional, and at the worst create something called graft versus host disease, which can create huge issues, specifically if these things are injected IV. And I've treated some people that have had significant rejection responses in their knee joints. They went down to Mexico and had some type of umbilical cord injection and had horrendous rejection inflammatory response where their knees ballooned up for months and months. And so those things also need to be considered. So all of that is just to try to educate. Right now, you know, we're the largest regenerative organization in the world. We've been around the longest. And if we thought umbilical cord products in the US were compliant, were better than bone marrow, then we would use them. There's no reason that we can't use them. You can just call up a rep and get it the next day. It's not really hard to start to use those products. It's just that they haven't been shown to be beneficial. There's limited human studies, there's limited safety profile, and they're not compliant with FDA. So that's why we've stuck more to bone marrow, because of the longevity of the data, our own data. We have 10-year follow-up safety studies. Dr. Patin in Colorado has another 2,000 patients he's followed and produced safety studies. And so there's just a lot more to kind of hold your hat on with using your own tissue, regardless of your age. We've treated people in their mid-90s and they've had good outcome. It all depends on what the condition you're treating is, and that will better predict what your potential is. So I love to have the replay so I can listen again. Yeah, so this is being recorded. I'll give you this information. Lauren, she's our patient educator. You can always email her. She always likes to reach out, but she can send you a link. And then we try to upload these to the Regenexx Las Vegas YouTube, so you can check it out there, but you can also get a link. You can either email Lauren directly or give a call, and then she can get you a recording of this. That will be easier if you just reach out directly to her with that. So there's a question, I have a labral tear and fraying. Would any of this help with that? Yes, we've treated. Now, there's different types of labral tears, degenerative, there's displaced tears, or just tears through and through. So a lot of it depends on the type of labral tear. If it's displaced and like pulled off the bone, or there's big gaps, then there's going to be limitations with what we can do. So I'll say that we have treated labral tears. We have had success in the hips and the shoulder, but we would have to assess more the location and the type of tear and the amount of gapping there is to see how much benefit we feel we could help, but it's definitely an option potentially. Do we accept Medicare? We accept Medicare for our consultation process. Medicare does not pay for platelets or bone marrow stem cell type therapies at this point. Regenexx is the only organization that has developed some coverage through our corporate program. So we have 1,300 companies that cover Regenexx, but they only cover them for employees. So if you're not employed from one of these 1,300 companies, then likely your insurance won't at least cover the platelet or the bone marrow type procedures. But you can also call Lauren and she can kind of look at what your coverage is and give you a sense of if there would be any amount of coverage there. Okay. So I will write down your email and I can send that study. Okay. Okay. With Regenexx being so transparent on procedures and the data, are these procedures at all accepted by insurance? So yeah, so they're not broadly accepted by insurance, but like I said, we're the only organization that has been able to get some coverage through self-funded companies. We have 1,300 self-funded companies that cover. It's growing every year. So probably by the end of this year, it might be double what it is now. Roughly close to 20 million people covered through that. We're trying to use that as a way to prove cost savings, outcome data, surgical prevention. And so hopefully eventually it will be covered on a more wide scale basis from the private insurance companies. That's just been a work. We've been at it since 2015, pushing and trying to get more coverage by showing their data, the research. So it's growing, but we don't have universal coverage yet. Yeah, so yeah, just another comment on the umbilical cord stuff. Yeah, they come from other people. And so you have to do due diligence, just like if you were going to get a blood transfusion, you would want to make sure that the laboratory and there's like a system set up for them to check, is it compatible with your blood? Was it checked for diseases that could be passed on? So these are little things that you have to think about aside from that the cells are young. That's maybe one component that could play a role that hasn't been proven out yet. And so those are the things that need to be researched more. And so that's one reason why we haven't started adding them as a potential option in our clinic at this point. In the future, it may change, but there are studies coming out more and more. So we'll be able to, as time goes on, have a better understanding of if those therapies, umbilical cord type treatments will be more beneficial or safe, or what conditions respond better to those versus others. So with time, we'll have a little bit more information, but there's no clear consensus on any of that right now. So as I was mentioning on the screen, Lauren, she's one way to get a hold of us in the clinic. If anybody was ever interested in a full consultation to better assess your specific candidacy, then you can call Lauren or email just to get in for a consultation. We do accept most insurances for the consultation process. So there's not a huge downside outside maybe spending some time with us in the clinic. Our consultations are typically an hour long. So, you know, for people that have been here already, you know that already and kind of what happens. For those that haven't, you know, it's sometimes worthwhile just getting a better understanding of your condition and what your options are. And then that might help you decide what, you know, make decisions on treatment options for your orthopedic problem. I don't see any other questions at the moment. You can always, again, get a hold of us at the clinic or through Lauren in our call center, education center, or come see us in the clinic. We're going to try to start doing these once a month at least. We will do some that are more joint specific, like knees and spine, and we'll try to do some for other conditions. So look out for that as well. Since there's no other questions, I am going to probably end that so people can get back to their evening. Thank you for joining me and spending time listening to me rant for the last 50 minutes. I know sometimes it's hard with being on this type of webinar where there's not a lot of interaction, but I do appreciate you taking the time, and I hope you guys have a good rest of your night.